It was good to welcome them from the campaign, the beds campaign today, outside. And as has been mentioned, a petition submitted by the Royal College of Nursing and the BMA collecting over 10,536 signatures. So I'd like to thank them for bringing this important petition before the Senate. I would also like to thank Jonathan Osborne, the retired consultant leading the beds and corridor care in A&E campaign, for raising greater awareness of the impacts of this shocking care that's allowed to happen day in, day out. I have continuously raised my concerns about the impacts of long waits for treatment in A&E departments, as well as the shocking, upsetting number of deaths occurring in A&E while waiting for treatment. As the petition rightly highlights, it is unfortunately becoming an all too familiar sight in Wales rather than a never event. To see patients waiting and receiving care on trolleys or not receiving care, on trolleys, chairs, sometimes in a cupboard, the back of ambulances. I even know a situation where a paramedic will leave a patient in an ambulance with a new paramedic coming on. When that paramedic comes back on the next shift, the same patient is still in that ambulance. How can that be morally right? Well, it's inhumane, it's cruel, and it's certainly unacceptable. Our hospitals should be places where people know they are going to receive treatment, a diagnosis, treatment and care at their first point of entry for many. This should not be places of waiting, fear and pain. We know there are a massive shortage of beds, and I know the current Cabinet Secretary denies that. And the previous First Minister said that we need less beds. So, it is really concerning. And they do say out of mouths of babes come words of wisdom. Well, I can tell you, part of that campaign today were two little children, a little boy and a little girl, and he had said to his parents, why is there this debate needed? Surely it should be simple. Well, he's right. It should be simple, and it should not be happening. Doctors, nurses and healthcare staff, for whom we all value immensely, don't feel valued when they're working, having to squeeze past beds in corridors or people in chairs. This safe and dignified care is not possible in these other places than in a bed on an A&E ward. The petition is a joint call from the Royal College of Nursing and BMA for the Welsh Government too. As has already been said, we need numbers recorded. And can I just tell you, I asked an FOI the other day on how many people over the last 2 years have died whilst in an A&E department. And between a Spitty Glenclwyd, a Spitty Bangor, a Spitty Mailer, the figure is 1,027. That is absolutely, it's a scandal. It's a scourge on your name as the Welsh Labour government. We need to pause reductions in NHS Wales hospital beds, and I liked what Rhys Owen said. I'm living proof that the minor injuries unit in Llandudno District General Hospital is absolutely fantastic. But I'm very concerned, Cabinet, and I raised it only recently with you, to learn, because now there's no doctor-led care and things like that, that they're now turning people away who think they can go to an MRU for a minor injury and are being sent to the bigger hospitals. That is pure madness. I agree with prioritising prevention and early intervention, but the lack of available beds is vital. I join the beds campaign calling for more community beds to be reopened so that people can be moved out of A&E and onto a ward. We need to prioritise the ease of transfer after treatment. A senior nurse has told the beds campaign that in Glenclwyd A&E, a senior medical director found that at the time there were 90 patients in Glenclwyd who should not even have been there. They should have been at home or in cottage hospitals or could have gone to an MIU. Mabon, well put together what you said and the experiences that you're having, but I must remind you, when you mentioned a quarter of a century failing by this Welsh Labour government in this regard, I must remind you that for many years your own party, Plaid Cymru, were part of the government. You've had cooperation agreements, coalitions, you name it, you've had them. But you've never prioritised that. So let's just remember this. The Welsh Conservatives are fully committed to ensuring the end of corridor care. And I tell you now, if there's a Welsh Conservative government, after the next election, there will be no corridor care. We will ensure that our patients, our residents, our constituents receive the absolute care they need and they deserve. Diolch.